Welcome back to Talk to Doc. I'm Maricel Laksa Pangilinan with Dr. Oye Balburias.
Joining us now is Dr. Ruben Casala. He's an endocrinologist at the Medical City and the attending doctor of our case study, Ms. Teresita Guidote. Okay. So there are two kinds of diabetes, right? Or two types of diabetes. Can we differentiate the two po?
Yeah, there are two types. So we call it type 1 and type 2. Before, we used to call it non-insulin dependent and insulin dependent. When we say type 1 diabetes, it means that the body is no longer producing insulin. These are very young patients, usually teenagers, 20 years old. Type 2 is more common among older patients. In this situation, the insulin is still being produced by the body, but there is insulin resistance. In other words, the insulin is not working well in the body, and that's why the blood sugar is elevated.
What tests should we do in order to distinguish one from the other?
You can do some blood tests like what we call the C-peptide. This is a test in the blood that will determine the capacity of the body to produce insulin. So if that is low, it means that the body is no longer producing insulin, and most likely you're dealing with type 1 diabetes, especially if the patient is a young patient.
So what do we have here in the Philippines? Ano po yung mas common sa mga Filipinos? Anong type?
In the Philippines and also all over the world, type 2 is still the most common.
So what are the factors that will predispose one to developing this type of diabetes?
Type 2 diabetes is actually a lifestyle disease. Nowadays, we see a lot of patients with type 2 diabetes because of the lifestyle change in the 20th century.
Ano ibig sabihin nun? Ibig sabihin
araw, diba?
sa diet?
Diet, yes. Dati naman, walang mga fast foods, right?
Yes, sir.
Dati, you eat only when it's time to eat. Now, you eat when you're talking to somebody, waiting for somebody, watching TV, watching movie, you eat, no?
And we're more sedentary kasi everything is for our comfort. Elevator, tabulator, escalator, lahat na lang.
Cars, you go to one corner, you ride the car.
So palagi, di ba, lifestyle change ang kailangan? Or mas maganda yung preventive na approach. If you already have it in your genes, for example, like me, my dad has diabetes. What do I have to think about? My lifestyle.
You're prone to diabetes because you have family history of diabetes.
So family history and lifestyle.
Yes. Sometimes people say, well, I don't have family history because, my dad developed diabetes at age 70.
They think it's age-related.
That's actually not true because the only reason why that patient developed late diabetes because, previously the lifestyle is still good. So, even if you have predisposition to diabetes, but your lifestyle is good, you'll probably develop diabetes at a much later age.
Yes. In the case of Teresita Guidote naman, she has this heart disease. Was it the right thing to do for her not to go through the bypass because of her heart condition?
Well, that's a gray area. It's actually difficult to answer that because, if you follow the guidelines, that patient probably will benefit from a bypass procedure because the patient developed acute myocardial infarction and there's really coronary artery disease. But, you have to discuss this with the patient. You have to tell them the risk, the benefits, the risk of doing a procedure. And the family decided not to undergo the procedure because of the age of the patient. So they decided that let's try first medical treatment, meaning control of the diabetes, control of the blood pressure, cholesterol. And she actually did very well. Because she follows up regularly and she really takes time to understand the disease and she really takes her medications. And when I tell her, you follow up on this date, she really follows up.
Importante talaga yung sumusunod ka sa doktor mo di ba?
Compliance.
And now she's already 83 years old and there's no chest pain. She's well. There are no complications.
But would you say that would there be complications because she's diabetic and at the same time having this heart disease and then going through that kind of procedure? Will there be complications if ever she pushed through with it?
Well, right now our result of our bypass procedures and angioplasty procedures are actually good now. The rates for complications are really quite low, at level with international standards.
Okay, sir.
But of course, it's like in medicine, there's no 100% guarantee always.
Yes, sir.
There's always that possibility of risk. So even if you say it's 1%, out of 100, there's going to be one.
Yes.
So you still have to say that to the patient. Kasi kung malasing siya, she'll be the number one for
Oh, no.
out of 100,
Pero,
right?
you know, Doc, many people want to know if there are telltale signs that people should watch out for that should alert them to the danger of developing diabetes. Ano
Well-
ba yung mga signs na yan?
Well, the signs of diabetes is due to the elevated blood sugar. When the blood sugar is elevated, then there's sugar in the urine. So when it goes to the urine, then you urinate a lot. So that's why we call it polyuria.
Polyuria.
That's
So
one
when
of
you
the
urinate
signs
a
na-
lot,
Oo.
Ihi
you
ng
get
ihi.
dehydrated. So when you're dehydrated, you tend to be thirsty all the time. So you always drink. At the same time, because the blood sugar does not enter the cells for the metabolism, then the cells are also deprived of nutrients
Okay.
like sugar. So the patient loses weight.
Loses weight then.
Okay, so if you are always urinating
Ihi ng
and
ihi.
then there's a sudden loss of weight,
Yeah.
totoo rin ba yung halimbawa there are ants dun sa urine?
Yeah, that's why we always say,
matamis.
Matamis.
dun
May
sa
sugar.
PDA slogan namin, mabuti pa langgam alam, di ba?
Oo nga. So
But
yun,
the
mga
problem
signs
there
na
is
yun.
really, you know, we don't use that for diagnosis. No?
But it's true.
Just to communicate.
Diba?
and to
Actually true,
connect.
Yeah.
but you know,
So-
just to educate the people,
Yeah.
you know, mabuti pa langgam alam. Because, you know, when you have sugar in the urine,
Okay,
then
ingat
the
kayo sa
ants
mga
will go to
wiwi.
your urine. But
Yeah.
actually, it's already late.
But
It's
actually,
already
the
late.
more challenge, Maricel, for endocrinologists like Dr. Casala is for those people who have no symptoms, sir, di ba? There are cases
meron
where you
ganon?
don't have don't have any
In fact,
symptoms.
majority of patients will not have symptoms. And that's the problem with diabetes.
There are patients who will only go to the doctor, to specialists
Kapag
like
grabe
him, pag
na.
may nararamdaman
Oo.
na. So that's the challenge for them nga to be able to detect it early so that they can help them, sir, right? So,
That's why we always tell the relatives of the patient to have themselves checked also, because it's possible that they also have diabetes
okay.
and they don't know it.
But definitely, if it's already in your genes and you're frequently going to the bathroom and there's a sudden loss of weight and
Yeah.
there are ants in the bathroom, most likely,
Most
kailangan na
likely.
magpa-check up.
Yeah.
Even if you don't have symptoms,
Go.
you have a family history of diabetes, you should have yourself checked.
Oo.
Because
Simple
it's
blood
bet-
test lang naman, di
Yeah,
ba,
that's
Doc?
a simple blood test because it's better to diagnose diabetes early.
Early.
The earlier you diagnose it, the earlier you treat it, the better the chance of preventing complications.
So for example, you've been already confirmed to have diabetes. What is the next step?
Well, the next step is, number one is change the lifestyle.
Yun. Okay.
Which is very hard to do,
Ano
by
mga
the way.
dapat iwasan?
Oh.
Halimbawa sa pagkain.
Well, you must not go always to the eat-all-you-can restaurants.
Upsizing.
Yan.
You
Yung ano,
should
yung
watch
rice
your
ba?
diet.
Babawasan yung rice.
And the way to watch diet is to make sure that you attain ideal body weight. Or if you're overweight, at least lose some weight. Because any amount of weight loss will be good for your health.
After knowing the things that a diabetic patient should do, so we know that there are complications
Yes.
associated with diabetes. So what happens to a patient
In fact-
if hindi siya sumunod?
In fact, when a diabetic is diagnosed, there's a 50% chance that that patient already has complications. Based on studies,
Ilang
about
percent, sir?
50%.
50%.
About 50% of patients newly diagnosed will have complications.
Meaning to say the complications will arrive or will happen to the patient whether he or she likes it.
Well, if the diabetes is well controlled, then you will be able to prevent it.
To delay it or prevent
Delay
it.
and prevent until your ripe old age. Like that particular patient, she's already 83 years old and there are no
galing.
complications.
Okay.
huh? So that has been proven already by a lot of studies that if you control diabetes very well, the chance of complication diminishes. It's a J curve, meaning the more control the diabetes, the lesser the chance of complications.
Yeah, I know that because like in our case, Jelly, our sister-in-law has been very supportive of Gary and his diabetes.
And Gary is type 1.
Oo. So that kind of support is very important, di ba po?
In order for them to help the diabetic, no?
Yes,
But
sir.
not only to help them, but also for themselves because they are actually at risk for developing diabetes. So they should learn about it, have themselves checked. And the lifestyle change actually is not only applicable to the patient, it's applicable to the whole family.
Yeah.
Yeah,
family.
actually,
So they should be more active.
mas
they
magkaka-benefit pa nga yung
Yes.
buong pamilya. Eh.
Correct. They should engage more in sports activities. They should lessen their eating in eat all you can restaurant.
Imagine mo may diabetes yung kapatid mo or yung in-law mo, tapos iimbitahin mo palagi sa party. Di ba? Parang wala namang support yan.
That's why, sir, as an endocrinologist or your society, so what are we doing? Because this is a disease wherein the support and the cooperation of the family is really needed. So what are the things that...
Well, education is very important in diabetes. Many studies have already proven that a diabetic who is well informed, there's a lesser chance of complications. That's why we're doing education programs in the society and also in Medical City. In July 19 to 20,
I have an activity.
that's Diabetes Awareness Week. So we have a lot of activities at the Medical City. We have free clinics, free screening. And on July 24, we are actually launching the Diabetes Club of the Medical City. The purpose of this is really to educate patients and to increase awareness among people.
Kasi nga, Maricel, we have to do this or else some patients kasi are intimidated or scared to ask the doctor. So we needed to come up with activities or programs that will attract them so that they can be comfortable in front of the doctors, that there's no stupid or right or wrong questions when you talk about diabetes. They really have to ask their doctors like Dr. Casala.
Yes, and you've really
It's
given us a
important
lot
that there's
of
a good
insight.
relationship between the patient and the doctor, especially in diabetes because it's a lifelong disease.
Yeah.
That's one thing that diabetic should always remember. Once a diabetic, always a diabetic.
I hope we were able to give you a better understanding of diabetes and how it can be managed.
But I'm sure our audience here, Maricel, would like to ask questions to our expert guest, kay Dr. Casala. But we'll have that after this commercial.
Yes, don't go away.